I want to start with the question which gets at a lot of the diversity across the membership of the network. And that is how you define or explain well-being to people. So if you are speaking to somebody who is uninitiated with the concept, how you explain what it's all about.
For me, I've worked most of my career in public health, so a lot of my influences come from that area. And the way that I think about well-being is it's not ill-being, it's not just being, it's well-being. And to me, it's a salutogenic kind of concept that is more than sort of living standards. It's more than sort of addressing deficits like poverty or homelessness, although those are all sort of very laudable sort of goals to have. To me, well-being is unique because it's more aspirational than just meeting those basic needs or respecting human rights in the case of things like housing. It's sort of that positive sort of lens on the way that Canadians live their life. So that's kind of the way that I think about it and how I distinguish it from other concepts like positive mental health or poverty reduction efforts or things like that. It's something different that sort of complements them in the way that it focuses on the positive aspects of what makes life worth living.
I think there are simple and complex answers to this question. The more that I think about it, the more I've arrived at this idea of thresholds. So there are minimum thresholds. If those needs are not satisfied, then that's everything. It's all consuming. So that could be, living in poverty and not getting your material needs met, not being adequately housed, being in addiction or mental health issues, being unsafe. Those become sort of determinant of your outlook. But once that sort of level of thresholds is satisfied, then it's about flourishing. It's about what conditions does it take to flourish. So it's about how we relate to one another, the quality of our interactions. It's about identity. It's about agency. It's about the state of sort of mental health in a positive sense, level of stress, that sort of thing. So I think well-being offers this meta concept that helps you to synthesize those other things that are determining the quality of your life.
I think some kind of common maybe kind of metrics to use to evaluate well-being we've traditionally seen is, let's say, levels of formal education, quality of housing and income, workforce levels. Those are very important, and I think those are pretty useful measures to evaluate. Now, within the Indigenous context, it's very important that many First Nations communities and in Indigenous communities may have a very distinct view of what well-being means for them and within their community. I've done some research in the area of well-being. And within the First Nations context, I added a new index, looking what I call the language index. So this is the percentage of the population in community that have knowledge of an Indigenous language. So that's just kind of one example of how a well-being metric can reflect Indigenous values. And working with a number of First Nations communities, there's some really innovative ways for approaching what well-being is and how they define it. One First Nation is taking a child-centric approach. So a lot of the metrics are around quality of life, health measures for children within the community. And it kind of goes hand in hand to having metrics for evaluating maternal health is really inherently linked to that. It's always important to have a more of a holistic perspective, and that's how many Indigenous communities approach well-being.
Well-being, I think intuitively, just the most humans know what well-being could mean or might mean. I mean, all the practical things that are the same for every human: oxygen, water, health, those pieces. And then there's an aspect of it that, of course, is different for every nation, society, culture, community, familial unit, individual, all those pieces that factor into what makes an individual, society, community, going back outwards of the circle, well. And there's aspects of happy in it, but it doesn't just mean always happy. There's aspects of course, health, but it doesn't mean that every person is going to live forever. And there's definitely something undefinable about it. And I think that is because there are unique factors in so many of those places. I think that's why it's hard for any of us to say this is well-being, because there is definitely that idea that it is a different concept